Hi, I'm Aaron Patzer, the co-founder and CEO of Vital. Today I'm going to walk you briefly through our product suite, which includes urgent care, emergency, inpatient, and patient access. Let's start out with emergency. ER Advisor sits on top of any EHR, getting a real-time view of your notes, your lab results, and everything that's going on. We know as soon as a patient is registered in your emergency department, and we're going to send them a text message that basically says, do you want to know how long you'll be waiting for treatment? See your wait times, your lab results, and more. Click here. There is no download. There's no username and password. All you have to do is click on this special link. Because we make it easy, because those text messages are in Spanish or Korean, if that happens to be your language and everything is translated, we get incredibly high utilization, 63% on average across millions of visits that we do each year, and about 75% in the pediatric case. Enter your last name and date of birth. That's it. This is a progressive web app. It's going to show you how long you're going to be waiting to see a triage nurse. It's going to explain what triage is, and there's going to be a video there for you. It's going to ask you to use your wait time as productive time, whether that is correcting contact detail, doing an early urine sample, or even having a list of your home medications ready. There is no work for your staff to do. It's going to move forward automatically. As soon as we see a triage note, it's going to move to now you're waiting for a room or a bed. These wait times are highly accurate in the wild, 94% accurate. We always overestimate by a little, and we always give a range. And that means that most people are actually going to get in under this amount of time and actually be delighted. Setting expectations helps not only improve your patient scores, but reduce your left without being seen. You can share your visit with family members, so they can follow along. It'll generate another special text message, and they can see, well, I'm waiting on treatment, or I'm waiting on a CT scan. I've got 4 of my 7 lab tests completed. Super useful. Again, in the pediatric case, if a parent is not there, sharing with the other parent is almost guaranteed. If you've been waiting for too long, we're going to automatically apologize to you. We're sorry you're still waiting. For places that have the staffing to do so, and this is really the only thing that requires additional staff, we have service requests. I'm cold, I'm thirsty, I'm in pain. These can be routed to techs, they can be routed to different departments, they can be turned on and off at certain times of the day. They really help with patient experience. For tests, I'm tired of the way that most of healthcare shows test results as a table of numbers, 46 micrograms per deciliter of BUN. I don't know what BUN is. We explain everything in plain English. It tests your kidney function. You have a complete blood cell count. You want to watch a video on what that is? We've got one in there. Why is my white blood cell count high, and should I be concerned? We're going to walk you through what it's used for and what the results mean. For imaging, we go even deeper. And so this is what we call our doctor-to-patient translator. If I show you the original note, it's almost incomprehensible to patients. You have a fracture of your lateral and medial malleolus. We translate that into you had 3 broken bones in your ankle so that people can actually understand what's going on. Skipping over to our inpatient product, if you happen to be in an emergency and you were admitted to stay overnight, we would produce this nice summary for you that says, hey, you're recovering from recent abdominal surgery, and we found blood clots in your lungs and abdomen. You're receiving medication through an IV to treat those clots, and you also have a kidney function issue. We're going to match patient education to you automatically. This summary is also AI generated. We're actually looking at all of the doctor's notes, nurse's notes, progress reports, physical therapy, occupational therapy, and we're going to pull out everything from today's plan of what's going to go on, dietary restrictions, including disabling the food ordering button if it's an NPO, to what goals you have and when you're going to leave the hospital. We don't know when you're going to leave the hospital yet, but we need to see stable blood clot management and improved kidney function. We're going to show you your test results, of course. We're also going to show you your medications with special attention and inpatient paid to pain and nausea medication and exactly when you're going to get that next hit of pain meds so you stop bothering your nurse about it. Education is going to be matched to you automatically through AI so that nurses don't have to do that. So that might be on your pressure ulcer or It might be your pulmonary embolism. It might be fall prevention. We're paying attention to all upcoming procedures, your CPT codes, your ICD-10 codes. We're matching education automatically so that nurses save a ton of time. The other thing that saves nurses a lot of time so that they don't have to act as a concierge for everyone is service requests. So things like empty the trash or I want my bedding changed, those might get routed to environmental services without the nurse having to act as a go-between. Room too hot, too cold, noise issue, it might go to a tech, it might go to a patient experience person. And these buttons can turn on and off at different times of day. You might have different buttons in labor and delivery, like a button to see a lactation specialist, versus those that exist in med-surg or the ICU. Our urgent care product looks similar to our ED product in that it predicts wait times, but it really shows you more of how many patients are in front of you in line. And it also lets you do some pre-visit scheduling. Tests is a little bit simpler because there's more point of care tests in here. But if you had anything that went off to the main lab, like a microbiology, Vital would send a text message to the patient when it resulted so that you have one less phone call in your urgent care. It's going to match learn videos to your reason for visit. So if this is somebody who came in for a cough or a cold but isn't quite sure what it is, it's going to explain what the difference between pneumonia, bronchitis, strep throat, and the common cold are. It's also going to let you get work or school excuses. So you can press the button to request a work excuse. And these can either be auto-approved or you can have a flow where you approve and deny them. Most people actually set them to auto-approve. And that just generates basically a PDF with a signature, usually the ED director or the urgent care director's signature, where you can save that or share it with anyone who needs it. At the end of all of these products is what we call Access Advisor. Discharge is a funny one. We often send people in healthcare home with 10 or 15 pages of incomprehensible instructions that just gets thrown away, with what you're actually supposed to do being buried on page 4. We use AI to parse out exactly what you're supposed to do next. So you need, in the next 3 to 5 days, to follow up with an orthopedic surgeon for a wrist fracture. And so what we're going to do is parse that discharge into your care instructions. Your wrist is fractured, might require a splint or a cast post-surgery, and you can read those instructions. We're actually going to show you who within your health system's network is the best match for you based on language, subspecialty, availability, and everything that we know about the doctor and the patient. So this is an AI find-a-doc or AI matching system. We might notice, for example, that Selena was listed in your discharge instructions because she was the on-call doctor, but she doesn't take your health insurance. So we're going to match you to another hand surgeon, Teresa, in your health system who does take your insurance. That's a big deal for patients, and it's the difference between them staying with you and going to a competitor. Same thing for a primary care doctor. We're also going to show you where your medications were sent and what your ultimate diagnosis was, and again, video education on that. And this can be CRAMES, Elsevier, EMI, any system that you have. We use ViewMedica by default. And we also have baked in Recognize a Care Team member, Access Your Hospital Records, where we get probably a 10 to 15% increase in your patient portal or your own health system app usage. So we work well with your ecosystem. That's Vital.